Hello, Mrs. Taylor.
Hello.
We haven't seen one another for a long time. What can I do for you?
One of my teeth broke over the weekend. The outpatient doctor said the rest of the tooth would have to be removed. What are my treatment options?
I'd like to have a look at it first. There are several possibilities. Let's see. First of all, the rest of this tooth will have to be removed. You then have the options of a traditional tooth-supported bridge or an implant-supported crown. When we replace a missing tooth with a traditional fixed bridge, the two neighbouring healthy teeth have to be ground down, and the root of the missing tooth is not replaced. The alternative, an implant-supported crown, presents several advantages. Your replacement tooth will look, feel and function like a natural tooth.
That sounds good, but how do I know if it's the right option for me?
In principle, almost every jaw is suitable for an implant. Let me show you. It looks as though there is sufficient bone here for an implant to be placed. And even in cases where the jawbone has defects due to abnormalities or disease, the jaw can be surgically built up again with a bone graft or bone substitute material. Please take a seat.
Technology these days is so amazing. What does an implant look like? Can you show me one?
This is a Straumann implant. It's made of pure titanium. Titanium is a biocompatible material, that is, it's accepted by the human body. As you can see, this implant is rather like a screw, so that it can be fixed firmly in the jawbone. Implants come in different sizes and shapes, so that they can fit optimally to the patient's individual situation. When you look at this model here, you can see that the implant is designed so that the supporting post for the crown, the abutment, can be screwed in easily after the implant is placed. The crown is then fixed to the abutment.
What exactly does fixed mean?
Fixed means that the crown is either tightly screwed or permanently cemented to the abutment that's connected to the implant. Which method is best depends on the individual tooth situation.
I understand. How long will it take to put the implant in? In my case, does it hurt?
We do the operation on an outpatient basis under local anaesthetic. It doesn't take long and you'll hardly feel a thing.
That's reassuring. I was a bit afraid it might be painful.
That's understandable. Most patients do tend to imagine a worst-case scenario.
When will I be able to go back to work?
In almost all cases, you can return to work the following day. I'll make you a temporary crown to close the gap, so no one will see there's a tooth missing.
Great. But what about the cost? It sounds expensive.
The cost depends on the type of treatment you need. If you like, I can have a personal treatment and cost plan prepared for you.
So how long do implants last?
Studies show a 95% success rate of implant treatment over a 10-year period. There are patients who've had implants in for 20 years or more.
Will the implant need special care?
Just as with natural teeth, regular care is extremely important. After the treatment, we'll show you how to look after the implant. And we'll expect you to come for regular checkups.
So how long before the temporary crown can come out and the final crown can be inserted?
The impression for the final crown can usually be taken after about 6 weeks. Well, if you're interested in the implant option, we'll be happy to arrange a full consultation for you.
This sounds great. I'll make an appointment right now. Thank you.
You're welcome. See you again soon, I hope. Bye.